You know, it wasn't up until this last period I had the transplant in '06. A new drug was approved, I guess, back in 2011-12 in CVIC by Vertex, and another one by Merck. So I forget the name of the drug, but they were approved, and I went to go see my doctor. And I said, "Oh, I'm ready to be on this new product, this in CVIC. I've done the research. This is the one I want to be on now. I'm ready to get cured. This is the one that's going to do it." And he sat me down in his office, and he said, "I can't give it to you." I said, "What do you mean you can't give it to me?" He says, "I don't want to blow out your kidneys." He said, "This drug in CVIC will interfere with the prograft that you're on that prevents the rejection of the liver. So that's going to interfere, and it could make your kidneys, fail because it's going to increase or decrease the levels of that prograft." So he said, "I can't give it to you." I was heartbroken. I was in tears at the time with this doctor, and I don't know if he felt guilty or bad, but he referred me over to a Pennsylvania hospital to get enrolled for a clinical trial of some of the newer agents, one of which is sofosbuvir, and which is now Harvoni. It was a combination of sofosbuvir and ledipasvir. It took me about a year and a half to get enrolled in that clinical trial. I would go over to see the doctor. He said, "Well, I don't have anything right now, but it's in the works. Call me in 6 months." So I said, "Okay, fine. I'll call in 6 months." He said, "Give it another 6 months. Call me in 6 months later." And then a gentleman by the name of Aaron was assigned to the case, and he said, "Now call me in 3 months." So I called him in 3 months, and he said, "Okay, we're working on something. It's coming soon. Call me next month." So I'd call him next month. I put it in my iPhone to remind me to call him. Well, finally, a year and a half later, after that first incident where I was denied the CVIC treatment, they said, "Okay, we're ready. We want you to come in. We're going to do a whole workup on you, take your blood. We're going to make sure you're eligible to enroll in this clinical trial." That was back in 2012, so it's six years post-treatment, post-transplant. I got enrolled into the study, and found out later I was the very first post-liver transplant patient to be enrolled in the Harvoni study, and I was the very first to clear the virus and to be cured with the virus. So it was an amazing experience, because here I was taking one pill once a day, and the ribavirin was I think 3 or 4 pills twice a day, twice a day. But here, that one pill within 2 weeks cleared the virus. And I'd gone through all that pain and suffering and treatments up until that point. And within 2 weeks, the virus is gone. I was ecstatic. And about the only side effect I think I had was the fact I was tired during the day and I couldn't sleep at night. So, which wasn't bad compared to what I'd been through with the interferon. So here I am today, and the virus is gone. I completed the trial, I guess, back at the mid-2013, so it went from 2012 to 13, and here it is 15. Now it's 2 years post-treatment, and I'm still clear of the virus. So thank God, and thank to Dr. Sophia.